So in the front, they call it the pubic bone, but it's really two halves. And because of that fact that it's linked by cartilage, there's a tiny little bit of movement. And so in a sense, a pelvis is really more like doing a tiny shifting forward and back. And so let yourself feel that feeling. Push off on your left foot and start to turn to your right, and just feel push off and turn. And if you let yourself, you'll feel the little beginnings of rotation, or the tiny little, we're not talking about a lot of degrees of freedom, right? But nonetheless, it's an important motion. And you can possibly, as you do this, and especially if you sit on one side and reach back with the other sitting bone, and this is subtle, right? If you do too big a gesture, you're going to be involving a lot of big muscles. But if you try to do a small gesture in there, your sacrum is doing a little rotation.
You can put your hand on the sacrum and sort of feel.
Good idea. So if you put your hands on your hips and you let your thumbs point this way, you usually can feel this indentation. And so if you can feel that indentation, and just sit on one side and let the other sitting bone slide back. So when you do that, you're beginning to feel the muscles. They have to let go, the muscles in the back of the pelvic floor. So that has a fancy name, levator ani, because it does lift your anus. So if you want to contract that sphincter, you'll feel that muscle doing the job. And if you contract a lot, you can probably feel that you can involve lateral rotators that are sitting this way, from your sacrum to your femur. And I did want to say one thing related to that. So I'm saying that if you squeeze your anus and you tighten, you can kind of feel how, okay, there's the local muscles doing it, and then if you keep tightening besides tension somewhere else, you'll also begin to feel the lateral rotators, and even the hamstrings work. So very often, so that name, lateral rotators, right? So that implies that when they squeeze, this happens, right? But look, if my foot is on the floor and those muscles squeeze, do they rotate my leg laterally?
No.
No, because it's a misconception. In early anatomy, they talked about muscles as having an origin and an insertion. Like it starts here and it goes there. And it always starts closer to the center, goes to the, so they would say the lateral rotators, start here and go there. And they thought about the direction of pull, and they described it that way, and millions of students learned lateral rotators rotate. But obviously it depends on the initial conditions. So you can't always, when you look in a book and it says this muscle does this, it's never really true, because it depends on the starting point. So if your leg is fixed, it depends on the fixed point. So now we try to use words like attachment that don't imply a direction in one direction or the other. And this is just, if you go off and you start to learn stuff and you look in a book, you're going to see why it's confusing.